With a glow of the screen and a heart full of pride, he's talking with experts from the world far and wide, broadcasting his voice through the good and the grand, on YouTube, Facebook, LinkedIn, and X across the land. Every Saturday morning, he's the urology man.
Hey, good morning, everyone, and welcome to UroNurse. I'm your host, Vic Senese. Glad to have you on board here. As I'd mentioned before, I'm vacationing in Florida, so it's nice and warm here. I know a lot of you are expecting some pretty cold weather, so stay bundled up if you are and stay safe. Hey, we got a great show for you, but if this is your first time checking us out, be sure to check out our website at uronurse.com, the best place to go to view all of our past episodes. Also, a chance to look at the sponsors for the show. It takes you right to their websites, and all of our other podcasts are linked in, all at our uronurse.com website. A lot of you told me you like to listen in your car. You got a long commute. We have our audio podcast, comes out about a half hour after every show. Every one of the shows has an audio only version, so you're welcome to check those out on Apple Podcasts, Spotify, iHeart, Amazon Music, and YouTube Music. And once again, all of our past episodes, all 176 of them, are available at our website to be watched anytime. So we've got a great show for you today. I'm going to be meeting today. We're bringing on Coloplast. We're diving into some meaningful updates for clinicians, reimbursement specialists, and anyone invested in improving patient outcomes. We're going to be focusing on Coloplast's newest advance in micro-hole zone design. Innovations that are changing the way we think about comfort, drainage, efficiency, and catheter performance. These design improvements aren't just about engineering. They impact everything from infection prevention to patient quality of life. But we're not stopping there. We're going to also break down the latest in ICD-10 coding updates, unpacking what they really mean for documentation, billing accuracy, and appropriate reimbursement. So whether you're on the front lines of clinical care or part of your organization's reimbursement team, today's topic is going to help you stay current, compliant, and confident. So stick with us, because understanding these advancements and coding changes can make a measurable difference in how care is delivered and reimbursed. So let's get started. I'll bring in the great Coloplast team right now. Hey, welcome, everybody. Welcome to the show.
Hey, Vic. Good to see you. Thanks for having us today.
Yeah, great. I'm going to let you guys give your own introduction so that people know who you are. Anna, why don't you start off and let us know where you're from and what you do?
Yeah. Hi, everyone. Anna Markowitz. And as Vic mentioned, I am in the snow state. So I'm in Chicago. So we have a lot of snow. It's very cold. I wish I was in Florida. But my background, as far as my career goes, is market access, payers, reimbursement for over 15 years. So that's kind of what I focused on. I've managed, various responsibilities and had different roles globally and just within the U.S. I've done some global end user surveys for catheterization, for ostomy users, really looking at quality of life for individuals that use those products. I serve on many industry councils, patient organizations, national patient organizations, DME associations, etc. And currently, I'm a senior manager of payer relations at Coloplast. Very happy to be here. Thank you.
Yeah, welcome to the show. Jessica, give us an introduction.
Hey, good morning, everybody. My name is Jessica Kenney, and I'm the Senior Brand Manager at Coloplast. So a little bit different than Anna, I'm on the marketing side. I've been at Coloplast for a total of almost 6 years, and always in the urology continence care space. So very familiar with intermittent catheters, and that's why I'm here to talk also about Luja. And unlike Illinois, I'm in Minneapolis, and I have you beat. It's even colder. It feels like temperature right now is negative 24. And it's going to get colder, I think, actually, as the day goes on. So we're going to stay inside.
You're the winner for the coldest weather, that's for sure.
I wish I was in Florida.
Yeah, kind of glad to be here myself. Hey, Molly, go ahead and give us a little information on you.
Yeah, good morning, everyone. I'm Molly Petrie. I'm a clinical specialist at Coloplast. So my background is in nursing. I also have a degree in health promotion and health education, and I really have a passion for teaching. My background is specifically in pediatric urology, where I was the lead nurse of the urology division at Children's Hospital of Los Angeles for a number of years. And I really fell in love with the patient population during my time there, and saw the actual difference Coloplast actually made firsthand in my patients' lives. So I wanted to reach people on a larger scale and work more with HCPs, having those clinical conversations. So I came on over to Coloplast, and I'm super excited to be here to talk to Lucia, the clinical evidence behind it, and
Great.
just be with all you guys. Yeah.
And I think you're the winner for the warmest weather.
Winter, yes. Definitely a little warmer than, 30 degrees or anything below 0.
Yeah. All righty. Well, I'm going to switch over to your slides and let you guys take it away.
All righty. Thank you. So just quickly going over the reimbursement, we want to make sure that, any information we present today is for general reference only. The information does not intend to replace any advice you receive from your own internal or external insurance or reimbursement experts or your legal counsel. All right, so first we're going to talk through the new HCPCS codes and the billing, and then we're going to get to the exciting Lucia stuff. So bear with me. I know reimbursement is not everybody's favorite topic. Currently, all intermittent catheters are grouped into 3 billing codes, right? And these billing codes we call them HCPCS codes, but that's just a fancy term of saying this is what a DME provider uses when they bill a patient's insurance for intermittent catheters. HCPCS codes are not specific to a brand or a manufacturer. They are more so think of it as a category of product with similar features, right? So your first category that we have, as it is right now, is A4351, which determines if the catheter has a straight tip, right? So these are all catheters that have a straight tip. They can be red rubber, they can be gel, they can be hydrophilic, they can be silicone. As long as the tip is straight, they're put in this A4351 HCPCS code category. The second category is A4352, and these are your bent tip or coude tip catheters. And again, what they're made out of does not impact the billing code. So anything from red rubber to hydrophilic falls into the same A4352 category as long as the tip is bent. And then finally, we have A4353. These are your closed system catheters. Sometimes they're referred to as no-touch types of systems. So they will often have a sleeve, like a protective sleeve over the catheter. They'll have a collection bag, maybe attached. Maybe the collection bag is separate. They'll come with gloves, drapes, antiseptic wipes, and those are your kits. There are over 1,300 products in these 3 HCPCS code categories. Again, 1,300 products. That's a lot of products to be constrained into just these 3 HCPCS codes. And anything ranging from red rubber, which was developed in the 1800s, to a hydrophilic catheter, right? So needless to say, there's just not enough product differentiation within each category. And really, the codes don't really appropriately describe the advancements in catheter technology that we've had, all the developments that happened throughout the years. So, therefore, if we can go to the next slide, please. Yep. Therefore, starting in January of 2026, we will have new HCPCS codes for intermittent catheters, specific to only the hydrophilic catheters. So this is a huge deal, right? Like for Coloplast, for all catheter users, for all clinicians, this is a huge deal that Medicare or CMS has finally realized and are recognizing the clinical benefits of hydrophilic intermittent catheters. So they are going to create 3 new HCPCS codes that will differentiate the non-hydrophilic catheters and hydrophilic catheters. And those will now be billed with separate HCPCS codes. New hydrophilic codes will also help to ensure patient choice and clinician choice, right? So both of that will get pulled through on the end, and patients will be able to receive, or end users will receive, the product that is being prescribed to them. And while, we are very excited about this positive change, I just want to reiterate that this is a coding update, a coding change, not a coverage change. So nothing changes with the catheters, nothing changes with Medicare coverage. It's just how they are billed. And I'll go over quickly these 3 new HCPCS codes. So as of January 1, all hydrophilic catheters will have to get billed with new HCPCS codes. A4295 is your straight tip hydrophilic catheters. A4296 is your coude or bent hydrophilic catheters. And A4297 are your closed systems that come with the hydrophilic catheters. The codes that I mentioned just a couple of slides ago will stay in play. However, their description will change. So all non-hydrophilic catheters will get billed with the codes that we went over earlier, and then hydrophilics would get billed with these new ones.
Awesome. Thank you, Anna. I know it's not always the most exciting topic to talk about billing codes, but it is really important. So I think the biggest takeaway here on the new codes is for your patients to remain on the hydrophilic catheter that you prescribed, they're going to need to have an updated prescription to receive their product in 2026, which is very soon. It's just a couple weeks away. And on the prescription, we just need to make sure that it includes the word hydrophilic or the brand name and item number and have that be on the prescription. So the more specific that you can get, the better. And that will work actually in 2025, so still this year, and in 2026. And just to reiterate what Anna reviewed, this is just a billing update only. The catheter itself isn't changing, but getting those updated scripts is pretty important. And actually, let me go back to here. So you should actually start receiving renewal scripts from your suppliers now. I mean, we've heard in the market that other people have started getting them even like September, October. You might see it gear up a little bit more as we get towards the end of this year. But we definitely need to make sure that your patients have that updated script, or they may not get the hydrophilic catheter that you prescribed. So we do have a couple of resources for you. We actually have a website dedicated for end users and a website dedicated to clinicians. So on the left-hand side here is for end users. It's coloplast.to/keep your catheter. And for HCPs, it's coloplast.to/new catheter codes. And also, if at any point you're told that your patient cannot receive the hydrophilic catheter that you prescribed, please call us, call Coloplast Care, and we can absolutely try to help you. And I think that's our last slide here for the HCPCS codes. I think we want to transition and talk about Luja. So we talked a lot about hydrophilic coating, and at Coloplast, we actually have our triple action hydrophilic coating technology on all SpeediCath catheters and on our newest line of intermittent catheters, Luja. So Luja has a microhole zone technology, and it's really changing the paradigm for bladder emptying. And with that, I'm actually going to pass it off to Molly, and she can go into more depth on Luja.
Thanks, Jess. All right, we'll go to the next slide. So if we kind of look back in time, we first had a first generation of catheters, right? These were uncoated single-use catheters where you maybe saw in our portfolio self-cath be primarily sold throughout the US. But we're constantly evolving and innovating, and we're really passionate about that at Coloplast. And that's the field of medicine, right? So then we moved on to our second generation intermittent catheters. And a lot of innovation happened during this time, from having to actually activate the coating on catheters to creating, triple action coating technology that instantly ready to use hydrophilic catheter was huge. And so really SpeediCath has been setting that standard for the past 20 years or so. But again, we move on to the next generation, which we'll be talking about and where we are today. And that's with microhole zone technology, specifically with our Luja portfolio itself. Now, we know that a lot of our patients struggle with UTIs, specifically those who intermittently catheterize. And we actually find that 45% of users who do CIC consider UTIs to be their greatest challenge overall, which is concerning and puzzling. And we really haven't had a better solution for bladder emptying and decreasing the risk of UTIs within this population. So Dr. Kenney, who is actually a urologist out of North Carolina, and a couple of his associates really looked at the UTI risk factors in this population because there were no clear guidelines on CIC and UTI prevention. And so through this process, they developed the UTI risk factor model. And so something that actually came up quite often as a theme within this was post-void residual. But to really understand what this UTI risk factor model is at first, if you look at the left-hand side, there is actually more modifiable factors that someone has more control over. Compared to the right-hand side, right, we can't change our age even if we want to. And so there's a lot more difficult factors to modify. And so post-void residual was a common theme within 3 of these domains. And so that's really speaking to if the patient is provided with the right catheter, if they're, sufficiently educated on handling the catheter and we're optimizing its design, we can address those UTI risk factors in patients who do CIC. And so really because of that, we at Coloplast challenge the notion, right? Why do we even have 2 eyelets on a conventional catheter? And is that really the best solution for bladder emptying? And so what we found in the video on the next slide I'll show you is a 2 eyelet conventional catheter compared to microhull zone technology, which is going to gear towards reducing that risk of UTIs and something called mucosal suctioning, which we'll see in the video if we want to play that. So you can see the conventional eyelet catheter on the left-hand side, and it's emptying the bladder. And all of a sudden we see that urothelium actually gets sucked into the eyelets. And I always think about what the patient is feeling in this moment, right? And so we actually see a flow stop. They have to reposition the catheter for the flow to go again. Compared to the right side where we see Luja with microhull zone technology, where we see that reduced mucosal suctioning. And so that allows for one free flow of urine. And that way the patient actually doesn't have to reposition the catheter when doing CIC itself. And so really Luja with the microhull zone technology was designed to drain urine from the base of the bladder and reducing that mucosal suctioning as you had seen in the video, and really allows the patient to not have to second guess whether their bladder is empty and if they got all of the urine out, right? Because they may have experienced that flow stop and having to reposition the catheter itself. So at Coloplast, we're really big on listening and responding. We're also really proud of the clinical evidence behind our products. And so we actually did a gland model, which you can see here. And so the purpose of the gland model was actually to examine that mucosal suctioning in a visual exam as well as a histological exam. So what happened was there was a water chamber that was actually set to replicate abdominal pressure, and a 2 eyelet conventional catheter was inserted. And we then took actually porcine bladder tissue and examined that with the 2 eyelet conventional catheter compared to Luja with the microhull zone technology. And you can see by the naked eye in the images on the left that we see some of that, I like to call it a love bite, on the actual urothelium. Compared to with Luja, we see that significantly reduced. And if we look up that really even more closely, right, under like a histological exam, on the left-hand side, I like to call this a purple pathway, where the outer layer of the urothelium is intended to be intact. However, after coming in contact with the 2 eyelet conventional catheter, we see that that purple pathway is disrupted. So that can cause potential trauma to the actual urothelium itself. Whereas we see with Luja and microhull zone technology on the right-hand side that that purple pathway stays more intact, right? Because we've reduced that risk of mucosal suctioning. And so the urothelium is allowing itself to continue to be a barrier to the urine and harmful pathogens within the urine itself. And so really Luja is not only designed to empty the bladder, right, completely, but it is also designed with keeping sediment in mind. And so the micro holes on the Luja catheter itself are actually 400 micrometers. And so really we wanted to look at this as well in terms of sediment. And so there were 3 randomized crossover clinical studies that looked at the performance of microhole zone technology and a 2-eyelet conventional catheter in terms of sediment. And it found that most sediment in the urine was around 50 micrometers, with the largest sediment reaching 200. So this is evident that with 400 micrometers itself, it can drain those larger sediment pieces if it's around 200 micrometers. And this improved performance is likely due to the design of the drainage zone, as it ensures continuous drainage of the urine and the sediment from the bottom of the bladder. So really the benefits of Luja, right? We've kind of talked about it, but really we're completely emptying the bladder without that need to reposition. And we're also reducing that risk and worry about UTIs due to PVR, as we talked about within the UTI risk factor model. And so I always like to think about, what does this mean for our patients, right? And I envision how this can empower them within their lives and also empower you within your practice itself. And so with that, Julie is one of our users who has, so her background, she actually has MS, and she was a lover of our SpeediCath compact female catheter and used it for a number of years and was, sold on that. She was like, I don't need to try anything else. And, we told her about Luja and encouraged her to just give it a try and get her feedback and see what she thought of it. And so when she was using SpeediCath Compact Female, she was having to actually wake up overnight to empty her bladder. And ever since she's actually switched to Luja, she doesn't have to wake up anymore overnight because she can have trust that she's completely emptied her bladder. And I think that also speaks to what I kind of just touched on, right? What does this do for our patients in their lives? How does this impact in the day-to-day? And that's what we're really passionate about at Coloplast. And so the next slide talks about making life easier. And that's what we're really passionate about. So we're really passionate about just making life easier for patients like Julie who have those intimate healthcare needs. And, that's kind of the core of everything we do and our hope and goal, with Luja in this 3rd generation. Here's some important safety information just on Luja itself. I won't read it off to you. But we thank you for the time. We're happy to answer any questions and are just happy to be here and connecting with you all.
Yeah, that was great. Really nice coverage of that. I'm going to kick off the questions, and those of you that are watching this live can certainly put questions into the comments and we'll bring those up. I see a lot of people on X today, which is great. Unfortunately, the questions you can't use the comments from X. I guess Elon doesn't want to allow it. But anyway, you could go to YouTube if you want to submit a question. But let me kick off a quick question. So with the new codes that came out, is there a difference in reimbursement for hydrophilic catheters versus, I know before they were all kind of paid the same. I don't know who wants to take that.
Anna, do you want to take that one?
Yeah, sure. So as far as Medicare goes, there is no differentiation in reimbursement. Medicare has not published their final fee schedule as of yet. We are hoping that they do that in the beginning of the year. But we do get a lot of questions about why isn't there a different reimbursement scale for hydrophilics versus not? So I guess I can just, what has happened is when a HCPCS code or a billing code is broken out. So we already had established codes for catheters, and they were just kind of broken out because of the feature, because of the hydrophilic coding. CMS doesn't have a mechanism to assign different pricing going up or down. So it's kind of a protective clause as well. It's a pricing regulation where they just don't have a mechanism to adjust the pricing up or down because the code is being broken down. What that's going to look like in the future, we're not sure yet, but that's something that, we're continuously looking into and discussing with CMS.
Good. So then it's important that you, when you're writing the prescription, mark down that you want a hydrophilic.
Yes. Yeah, that's really the key, Vic, is we want to make sure that they write hydrophilic on the prescription. And then that's going to work today. That'll work next year. And that will make sure that your patients get the catheter that you prescribed.
And is there any difference between the Luja as far as coverage or cost or to the patient if they decide to go with the micro hole technology?
Nope, not at all. That's a really good question, Vic. Yeah. Luja is going to be the exact same as any other hydrophilic catheter. So whether it's SpeediCath Compact Female, Luja Female, they're all grouped in that same now new hydrophilic billing code. So there's no difference there.
Great. And I heard Dr. Kenney give the talk at SUNA about the Luja technology, and it really kind of piqued my interest. Of course, I've been doing this for 40 years, and I've taught patients self-cath for that time. And it's important to try to keep up with the latest technology. I'll admit I was resistant to going to even hydrophilic in the beginning. I just felt like it was too messy and wasn't a great advantage. And finally, one of the reps, who was a friend of mine, I'd known him for years, got involved in working for a company with catheters and said, "Would you just try it?" And I did. And I'm like, actually, this is more slippery to use the hydrophilic catheter. So I was a conversion at that point. But the Luja, I'm mispronouncing it, I'm sure, catheter with the holes, that's another different step that people may not realize. And a couple of weeks ago, we had Todd Thompson on the show. He's like the guru of catheters. And he was talking about the natural microbiome and how a lot of the problems with urinary tract infections is breaking down that lining that we all have in our bladder. So maybe one of you could address how that Luja actually really improves that problem, decreasing infections. Who's going to take it?
That one?
Yeah, I'll take it. Yeah. So I think exactly about the gag layer, right? And the urothelium when we're talking about mucosal suctioning, and saw that in that video. And so we saw in that video as well, right, when mucosal suctioning is happening, that became quite angry and red when using the 2-eyelet conventional catheter. So thinking about what that is doing to the urothelium, you can actually see in the video itself small little particles that kind of do look like bladder tissue. And so, drawing upon that, right, and thinking about what that does if a patient is catheterizing, 4 to 5 times a day, that's quite often, right? And potentially breaking down that barrier in the urothelium. And so if we're really, if we don't have that protective mechanism and that layer, we're going to be more susceptible to harmful pathogens within the urine, and that, can be penetrating further into the layers of the bladder, putting someone at a potential risk of UTI. Also, it goes with, complete bladder emptying. So because there's mucosal suctioning, a patient may think that, their bladder is empty. And so they remove the catheter because they've seen that flow stop, when really there may be 60 cc's or more or less in the bladder. And that proliferates over time. So if we have the mucosal suctioning mixed with that, that's just a big concern, right, overall. So it's really important to be addressing that and addressing complete bladder emptying while also reducing that mucosal suction to protect the inner lining of the bladder, while also making sure that we are removing any harmful pathogens that may accumulate over time as the urine kind of produces and sits there in the bladder itself.
Yeah, that makes a lot of sense. And I did get this question here. Is there actual evidence? Has there been some reports to kind of prop up that this is actually happening, that with this multiple islets, that it decreases trauma?
Yeah, so we actually... Yeah, I can take this one too. Yes, there was actually a clinical study on 2-eyelet conventional catheters compared to Luja as well. And so the users within that study had actually tested the conventional eyelet catheters, and they had then done an analysis as to whether mucosal suctioning occurred. And so over 45 times, out of those 45 times, mucosal suctioning occurred 44 times out of that.
Wow.
And so that's quite significant, right? And so that was significantly reduced when looking in comparison to Luja itself.
Yeah, great. Another question that came in here. How does this technology perform in challenging scenarios like low urine output, sediment, or hematuria?
I can take that one as well.
Right.
Yes. So in challenging scenarios, if they have a low volume of urine in the bladder, the catheter is designed to drain from the base of the bladder. So that microhole zone it's a couple of inches, right? It varies from Luja female to male, but there's that zone that drains from the base of the bladder. So instead of inserting a catheter and the two conventional eyelets are, kind of towards the top of the bladder, and then you're having to withdraw back on the catheter to get the urine from the base of the bladder, Luja is designed to drain from the bottom of the bladder itself. So it should, drain that urine that's sitting at the base. Same thing with the sediment. So most sediment is ranging from 50 to 200 micrometers at the largest. Usually, it's not visible to the naked eye. And Luja's microholes are 400 micrometers. So that is larger than the average sediment seen in, someone's average urine analysis itself.
Makes sense. And hematuria, that's going to be a problem no matter what. I'm not so sure a blood clot's going to fit through anything.
Exactly. Yeah.
All right. That's great. I did see another one come here. Oh, let's see. What feedback have you received from nurses and patients since introducing the newer design? So somebody out there in the sales land want to address what they're hearing from
I can take that one, Vic. So the feedback has been very positive across the board from end users and clinicians. I think when Molly asked the question about why do catheters have two eyelets, nobody can really answer it, right? And then when you start thinking about it and you see how the bladder just nicely collapses around Luja, how it fully drains it. And from an end user standpoint, the feedback that we're getting has been super positive. So a couple things that we didn't include in the deck, but for men, it's about 45% faster to drain. So the actual speed is faster, which helps with compliance. And then with women, there's actually no discomfort with Luja female because there's not that pinching that's going around. So especially end users are giving really positive feedback. And then also just the confidence to know that their bladder is empty, right? And knowing that and being confident with that as they go about their day.
And I don't know if any of you have a actual catheter kit with you that you can show, but I think the packaging is a big deal for a lot of people out there.
Yeah, I didn't bring any home with me, and I should have. I don't know, Molly, do you have any with you?
I do. Yeah, if it's okay, I can go grab some.
Yeah, I think it'd be nice to. We have a lot of people that are non-professionals that are in the audience that watch this, and one of the things that I always get a complaint from patients is I don't want something that looks like it's a catheter, so they want to conceal it. They don't want it, and they got to dispose of it. So maybe they're in a public restroom and they're walking out with something that looks like a catheter. And I think that you guys did a good job of kind of disguising yours in the who knows what it is. So
yeah, Mal, do you want to go grab it?
Yeah, I'll be right back.
Okay, I'll talk about it while you go. So, Vic, our products are made to be discreet. So we always think about the end user in mind and for them to be out and about and have a product that doesn't look like a catheter so they're not embarrassed. So when Molly comes back, you'll see Luja female is about this big, and it's made to look more like something that a woman might have in their bag. The packaging is made to be discreet. It's light gray. It kind of blends in. Nobody's going to know what it is when they see it in their purse or their bag. And then for men too, you'll see with Luja Coude, it's actually compact. So there's two different sizes. There's the standard size, which is about this big, and then the pocket size, which is probably about this big, and it's in a loop. But again, it's gray. It's designed that you could put it in a pocket, put it in a bag. You're not going to know what it is. And compared to, like, let's say you were using a standard coude, which is the packaging sometimes is about this long, right? This is discreet.
Yeah. You couldn't get it in your pocket. That's for sure.
Exactly. All right, Molly, you're up.
All right,
Right,
Molly's
okay.
back.
This has been open just because I have done demos with it, but this is kind of the packaging for Luja Coude in the smaller compact size that
That's the pocket size.
Yeah, exactly. And so then I actually have the product here. So it can come twisted, and then it actually just comes in this nice ring, as opposed to, you know, some catheters are right, just this long stick. And so you would open it up in a smiley face, and it has that triple action coating technology and the micro holes on the tip. I don't think you could probably see with my computer. But really nice.
There is a dry sleeve on there. So as you can see, Molly was holding it. So it actually has a dry sleeve. So you can touch it, hold it. If you would drop it, you don't have to worry about contamination or anything like that. And it's nice when it's dry, so you don't touch it. Your
fingers don't slip as you're trying to, push it in.
Yep, exactly. So they would insert it, and then when they're done, they can close it back together, and then all the urine stays in the sleeve, which is super nice. And then they can just dispose of it.
Yeah.
And you can also attach some extension tubing or a drainage bag if needed to both of Luja catheters itself. And then I have the female here, so really nice and compact. If you can see how I'm holding it. So you can just put it right in your pocket and no one will really notice what it is. May think it's an eyeliner, right? Or some kind of makeup. And then you kind of just pull it and wiggle. And then there's it as well.
Yeah.
Yep. So they're instantly ready to use with that triple action coating technology, and then with the micro hole zone technology too.
Yeah. And that's a big point because, like I said, I was slow to come around to hydrophilic, but you always had to bring lube and your catheter supplies. Yeah. So you're really, if you're in a public bathroom, you're really kind of at a disadvantage where these products are ready to go. Wash your hands, go into the bathroom, and you can utilize them. And most importantly, no one knows you're doing it, which is the whole key. I know, everybody kind of feels bad if they, have. I don't know why, when they were first making self-casts, they never thought about that. But, it was a long, straight package that you could see the catheter in. It's pretty obvious that you're carrying something around. And, the trauma of being a kid, and if you have to use these things, is just unthinkable.
I know, the kiddos. That's actually a good point, Vic. Actually, Luja Coude and Luja Female actually both have pediatric indications as well. So they are available for kiddos too.
All right, good. And for our healthcare workers out there, if they don't have it in their office or want samples, there's some way to get those.
Yeah, just reach out to Coloplast. We have reps all across the country. So if you don't have any product samples, just reach out to us, let us know, and we would have a rep stop by and drop off samples for evaluation for you.
All right. Well, great. I don't see any other questions coming in. So any other comments anybody wants to make before we move on to the end of the show?
I just thank you for letting us come. I know, especially both of these are super important, both the billing codes, the new HCPCS for the hydrophilic HCPCS codes, and then also getting to talk about Luja. So thank you so much.
Yeah. No, I'm glad. I actually was trying for the longest time since I had heard Dr. Kenney talk to try to get someone to come and do some talk for UroNurse to have this out there because it's important. It's really, for me, it's a life changer for patients to be able to not have to walk around with a catheter. I made it my goal was to always try to convert people that had to have a catheter into intermittent catheterization. I had one holdout who wouldn't do it. And the guy said, hey, it's just more convenient. I don't have to ever worry about it. Just empty the bag every, 6 hours or so. He was happy. What can I say?
Right.
All right. Let me see. We got some comments coming in. I'll just share those. Thank you. Good information. All right. And next week on UroNurse.
In this powerful and uplifting episode, host Vic Senese sits down with women's pelvic health expert, Doctor of Physical Therapy Neeraja Suryawanshi, to explore how women can rebuild. In this powerful and uplifting episode, host Vic Senese sits down with women's pelvic health expert, Doctor of Physical Therapy Neeraja Suryawanshi, to explore how women can rebuild, restore, and thrive at every stage of life. From core stability and pelvic floor strength to intimacy, continence, postpartum recovery, and holistic well-being. This conversation gives women the tools and confidence to reclaim their bodies and transform their health. Dr. Suryawanshi breaks down what really happens to the pelvic floor, why symptoms often go unaddressed, and how the right therapeutic approach can change everything. Join us on December 20th at 9 a.m. Central Time to learn more.
There you have it. Join us next week. We're going to have a physical therapist on to kind of talk about the things you can do to help improve your bladder function. So it'll be looking forward to that. Hey, it's been great having everybody on the show today. Bear down, get ready for that cold that you're going to get if you're not living in California or Florida right now, because the rest of the country, I think, is going to get whopped. But anyway, it's been a great show and really enjoyed having everybody on. And we'll talk to you all later. Bye-bye for now.
Bye.
So here's to the mornings, the coffee, the monitor glow, to the wisdom he shares and the folks that he knows. Saturday's special when Vic's on the stream with 40 years of knowledge and a head full of dreams.